next one is, we'll pick your feet up, stay in the hook line, is just simply a bridge. So again, it's the same thing. I'm supporting here right at the malleoli. My pressure's here. I can support here. And then if not, if you're losing hands, you can support here. So I'm using my own body. And then we're going to bridge your butt up. So pick it up, up, up. And so I'm using tactile cues and back down. Okay. If he or she's extremely weak, they might do a partial bridge, or I can almost help with that. Again, I start losing hand placement at that point, though, because I've done it this way, but I'm starting to lose hand placement with the ankle, too. So it just depends on how severe they are. But you can do bridging. If they're higher level, this involved side is retracted, correct? Remember, this side is retracted. Another way to do it is, again, I'm supporting here, and then take my hand and place it right over the ASIS, and I'm just giving him tactile cues. So go ahead and push, 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 push against me, push, push, push. And so it's encouraging him to push.
Make you want to go that way, yeah.
Yeah, and see, a lot of times, again, it's retracted. So I can do a modified bridge that way by giving him tactile cues that way. Okay? So
it's also pre-gait, which is nice to get that rotation. You know, to get that pelvis.
Correct. You're trying to clean up his gait as far as his alignment at that pelvis on there. The next one is the arm. We're going to go into the arm in this position, and then we'll break up and we'll practice. Okay. So with this one, so I'm going to take his arm, and if you guys want to come around here, what I do is I'm going to take my hand here, and again, I like to use my web space. I'm careful with my thumb because of his long head of the biceps tendon. Here it can be painful. And I'm supporting his arm here, his humeral head, and I'm supporting that just like this. So, because when he raises it up, I don't want it to translate way up and do the shoulder hike. So I'm supporting it here and hold his arm here in this position. But you'll feel the humeral head basically slide right next to that glenoid fossa there. And so I can support here, and then what I'll have him do, a lot of your patients you think that can't do it, surprise you can, is I'll have him touch his nose. So go ahead and touch your nose, and then straighten it out. Push, 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 push. Okay, touch your nose, and straighten out. Push, 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 all the way straight. There you go. Because what am I emphasizing? I'm emphasizing which muscle? Triceps, because the most common problem is it wants to go in a flex position. So I'm encouraging that. The other piece of that is I can take right up along the joint, I can encourage external rotation. So I'm avoiding that pathological internal rotation. So I'll take my hand, so when you're practicing this, make sure you take your hand and actually rotate to keep in position. So I'm here, and then just have him touch his nose. So go ahead and touch your nose, control, and push. Push, 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 push. Just like that. Okay?
Why are you at that angle?
What do you mean? This, like...
The 90-degree flexion angle.
Just because what happens to the humeral head when you flex it, it goes into position. So a lot of our stuff that we're going to do, we're going to get maybe 60. It doesn't have to be right 90, but it puts the head of the humerus into that socket. So a lot of the motions, the turning, we're going to be having them work on that, keeping it from subluxing, because that's where you see the tears and the pain, is you're keeping it aligned here on there. I think, so let's go ahead and